in a city offering breathtaking views of America's great expanses, the American Optometric Association kicked off a year-long celebration commemorating a milestone in expansion of optometric services for elderly Americans.
At each of your chairs out there, hopefully you will see that you have a pin out there. This is a Medicare 25th anniversary pin, and I want you to take this as a memento and wear it. AOA's 20-year battle for full reimbursement under Medicare ended when the Congress passed its 1987 Budget Reconciliation Bill, signed by President Reagan on October the 21st, 1986. Included in the bill was the long-sought change in Medicare, allowing payment for vision care services performed by optometrists.
In 1986, it was really the recognition that optometry is not just a vision care profession. We are a full-fledged healthcare profession. When Medicare started in 1965, optometry wasn't recognized in that manner. It took a full 21 years till 1986 for optometry to be recognized for the full role and the full capabilities we have to be able to provide our patients with those needs.
It was a huge leap for our practice and able to continue to provide full care for all of our patients from age 0 up until their senior years of life.
AOA's president during that period was David Ferris, who remembers that the battle was touch and go and success was not ensured until the final hours.
The most interesting part of it was at the very end, in the last months of 1986, when the House and Senate passed the Budget Reconciliation Act, and then the President vetoed it, and then it went back to Congress, and then we had to get back in inclusion, and it was just a madhouse of going back and forth to the Senate, to the House, to our friends, advocates up there, and working with them to make sure that we were not only included in the budget, but that we stayed in so that we would not get excluded at the last minute.
The AOA's champion in Congress 25 years ago was then Representative Bob Whitaker, who was also an optometrist.
Every time a senior citizen came into our office, we had to tell them that if they chose us for their services, we could not be reimbursed for those services. Optometrists all across America lobbied their members of Congress, and many from every state traveled to Washington to extend their lobbying services. And when our amendment came up, all those chips were called in, and then some more besides. One thing that we found very much in our favor was the amazing goodwill optometry experienced in the political arena.
The AOA's staff during that period, including the late Jim Clark, who headed the Washington office, was instrumental in making that vote possible. Jim Clark's widow, Pat, was on hand as AOA members showed their continued appreciation for his contribution. 25 years ago, House leadership gave Jim Whitaker the gavel used in that historic conference vote, which gave parity to the optometric profession. 25 years later, the former congressman passed that gavel and the torch to the next generation of AOA members.
Every time they see a Medicare patient, I want them to think about the AOA and the leaders of AOA and the staff people of AOA who had the foresight 25 years ago to know it was important to make sure optometry was included in Medicare, and they had Medicare parity.
Every day that the House and the Senate is in session in Washington, there's an opportunity for someone to change the law and remove optometry from this provision. So we never sleep. It's a 24/7 effort by the AOA to defend and protect America's seniors' access to optometrists under Medicare.
There's always going to be challenges. I mean, we are a legislative profession, and as long as there's groups out there opposing us, either trying to increase their scope of practice or trying to decrease our scope of practice, it comes down to we need to be unified as a profession.
And as AOA's new president, Dory Carlson, began her term of office, the goals and challenges ahead are clear.
The observance of the 25th anniversary of the inclusion for optometry in Medicare was absolutely wonderful to have in our House of Delegates at this meeting. So many people don't realize the battles that were fought before and the folks that did all of this work to get us that access 25 years ago. And what they did back then has affected us so much all these years since. And we actually have an opportunity with healthcare reform that what we get defined now will probably have the same sort of impact on our profession 25 years in the future.
In Salt Lake City, Utah, this is Nancy Mathis reporting.